I'm Dr. Anthony Claude. I'm a board certified psychiatrist. In this video, I'm going to talk to you about why I think the medications and the treatments we have for psychiatry are so limited, and there's so much more that one needs to do in order to have good mental health. For example, the brain has billions of neurons and several neurotransmitter systems, and all these neurons and neurotransmitter systems work together in a way to communicate to each other and the rest of the brain and body for it to signal and to act and do what it does. So to find one medication or one treatment device or one approach that is going to fix what's wrong or not firing correctly in this complicated system is going to be probably impossible. When someone comes with a mental health problem, it's not like they have an infection or they have an antibiotic that can attach to a bacteria and kill the bacteria. It's not like they have one receptor on the blood vessels that can be changed or adjusted so that the blood pressure can go a little bit less. It's much more complicated than that. There's a lot more that goes on in the brain. It's one of the final frontiers of science. Along with the vastness of the ocean and the mysteriousness of space, we have the brain that we just don't know that much about. So much of what is being pushed onto doctors is from corporate America, whether it's new medications, whether it's new devices that can help provide treatment. But really what's in a lot of these things is money for the corporate America. It may not be what's best for the patient. It might help a little bit, but it may not be what's best. I'm just trying to point out that mental health and mental illness is not going to be as straightforward as a lot of the science we have for other medical conditions. Yes, we use a lot of medications to try to treat stuff, but again, the brain is so fascinating and so deep and complex that it's unlikely that one medication is going to solve it. A lot of times it's a whole lifestyle approach. It's taking into account what runs in families. It's making sure people aren't using illegal drugs or too much alcohol. It's making sure that people are getting enough exercise and eating good foods and getting in touch with their psychological health, with relationships with others, getting in touch with their spiritual life. That is all important in order for someone to have overall good health and well-being. Even the researchers who have been studying the cutting edge medicines like psychedelics and ketamine to find out if those are effective, more than the medication itself that's effective, it's the experience of getting this treatment, maybe going to a clinic, talking with staff and nursing and being monitored while receiving these medications. That whole experience is what brings more health and healing than just the medication itself. Recently, I went to this national conference for the psychiatrists, and I realized that what the lectures are talking about are much different than what corporate America is pushing onto the psychiatrists. Corporate America is often pushing the new medications. It's often pushing the new devices. Maybe it's pushing new work opportunities, maybe treatment apps, new places to work or work environments. But it's not necessarily pushing the right treatment for the patients that we deal with. I think the right treatment is going to be taking their whole life into account. It's making sure that they are having all those aspects, like having those good lifestyle habits that are helping them to have overall health and well-being. It's not going to be overly focused on medications or specific treatments because we just don't have the data and the science these days to really know the exact ways to treat people. We think, for example, that depression is related to the serotonin or norepinephrine or dopamine, but we don't know for sure. We think the hallucinations and the paranoia and that stuff is related to too much dopamine in parts of the brain, but these medications aren't really that effective a lot of times. So really our knowledge, our ability to use these medications are limited. It's just one option that we have to try and help the situation, so we often have to push it and prescribe it onto others. Just hopefully this video helps to shed some light that there's so many avenues that can take place in mental health, and that's why I have all these different videos across my channel trying to help get that message across.